Good afternoon. My name is McLean and I'm going to talk to you about Rita and her rheumatoid arthritis. So a quick summary of Rita's situation. So she's 62 years of age and she has 15 years of history of rheumatoid arthritis. She complains of general fatigue and weight loss, along with symmetric joint swelling, stiffness and pain. The stiffness is more prominent in the morning and subsides during the day, and laboratory tests reveal a rheumatoid factor of 120 units per mil with the following non-reactive, weakly reactive and reactive results as well. So the pathophysiology of rheumatoid arthritis. Firstly, inflammation is part of a non-specific immune response that occurs in reaction to any type of bodily injury. The key signs of inflammation can be explained by increased blood flow, elevated cellular metabolism, vasodilation, release of soluble mediators, extravasation of fluids and cellular influx. In some disorders, the inflammatory process, which under normal conditions is self-limiting, becomes continuous and chronic inflammatory disease develop, like rheumatoid arthritis. So rheumatoid arthritis typically presents as symmetric polyarthritis affecting more women than men and is linked with the presence of autoantibodies in the serum, such as anti-citrullinated protein antibodies, ACPA, and rheumatoid factor. Genetics plays a role in the onset of rheumatoid arthritis, with HLA-DR genes having strong association with the disease. Axonal involvement is very rare, with the exception of articulation between the dens and the atlas. Chronic inflammation in rheumatoid arthritis is leading to cartilage and bone destruction, which is typically recognised as erosive disease on X-rays. Rheumatoid arthritis is an autoimmune disease, as an abnormal immune response of the body against substances and tissues that result in a chronic systematic inflammatory disorder, which is a complex biological response of vascular tissues to harmful stimuli such as pathogens, damaged cells or irritants that may affect many tissues and organs, but principally attacks flexible synovial joints. It can be a disabling and painful condition which can lead to substantial loss of functioning and mobility if not adequately treated. The process involves an inflammatory response of the capsule around the joints, synovium, and secondary to swelling of synovial cells, excess synovial fluid and development of fibrous tissue in the synovium. The pathology of the disease process often leads to the destruction of articular cartilage and ankylosis, which is the fusion of joints. Although the cause of rheumatoid is unknown, autoimmunity plays a big part, which leads me to the regulatory T cells. So nature has provided the developing immune system with several important checkpoints for the maintenance of tolerance and prevention of autoimmunity. TREGs, which are your regulatory T cells, function of abnormalities has been identified in different autoimmune diseases, including rheumatoid arthritis. Changes in TREG cells can be linked to the degree of inflammation and relapsing remission periods. It is reported that the balance status between these cells, the subsets, and their antigen expression will determine the inflammation levels and could be linked to the relapsing remission periods of the disease. TREGs are important cells in the maintenance of immune homeostasis. Defects of TREG's function or their reduced numbers have been documented in several human autoimmune diseases, including rheumatoid arthritis. The role of TREG cells in rheumatoid arthritis has been established in both patients and animal models. So the natural regulatory T cells is attributed to failure of both CD4, CD25 regulatory T cells and CD8, CD28 suppressor T cells to control autoreactive CD4, CD28, Th1 and autoantibody producing B cells. TR1 and Th3 regulatory T cells are immunosuppressive cells and they exert their suppressive capacity via cytokines, such as interleukin-10 and TGF-B. CD8 plus regulatory T cells suppressor cells that may directly inhibit other T cells or condition antigen presenting cells in such ways that immune strengthening steps are weakened. NKT regulatory T cells are deficient in patients with rheumatoid arthritis. So Th1 cells have the harmful function in immunopathogenesis, whereas Th2 cells exert favourable responses, and the Tregs suppress autoreactive responses and maintain self-tolerance in immune system. In rheumatoid arthritis patients, the percentage of CD4, CD25, GITRT cells in synovial fluid is significantly increased compared with the peripheral blood. And both these percentages are higher than that in peripheral blood with healthy populations compared to the rheumatoid arthritis patients. Immunopathogenesis of the joint changes that occur with rheumatoid arthritis. During the inflammation process, the normally thin synovium becomes thick and makes the joint swollen. As rheumatoid arthritis progresses, the inflamed synovium invades and destroys the cartilage and bone within the joint. The surrounding muscles, ligaments and tendons that support and stabilise the joint become weak and unable to work normally. These effects lead to the pain and joint damage, and often in rheumatoid arthritis. Researchers studying rheumatitis now believe that it begins to damage bones during the first year or two that the person has the disease. One reason why early diagnosis and treatment are so important. Some of the functional limitations in individuals with rheumatoid arthritis are as follows: flexibility deficiencies, biomechanical deficiencies, muscle strength, endurance, speed, and proprioception. So, how does the pathophysiology of rheumatoid arthritis relate to Rita's symptoms? So, Rita symptoms were described as one of them as general fatigue. So, muscle, ligaments, tendons support and stabilise the joint become weak and unable to work normally, which would lead to being less efficient, causing fatigue. Weight loss, so dry mouth, exostomia, loss of taste, limited movement causing decrease in muscle mass, therefore atrophy and weight loss. Symmetrical joint swelling, stiffness and pain, which is very common and has been highlighted in studies, with symmetric pain through rheumatoid arthritis. And the stiffness is more prominent in the morning and subsides during the day. So one reason for this is the warmth can decrease pain as the day comes on. But another study by Ashton, which is down there below, as you can see, showed that the distraction of daily activities actually decreased levels of pain, and that there was a complex relationship between pain, fatigue, stress, and mood. So what is the significance of Rita's rheumatoid factor test results? So testing for rheumatoid factor is the most widely used blood test in the classification of rheumatoid arthritis. Rheumatoid factor is an immunoglobulin antibody which is able to bind to other antibodies. Rheumatoid factor tests the amount of rheumatoid factor antibody in the blood. High RF makes the blood cloudy, so less light passes through. So above 20 units per mil, persistently active synovitis, more joint damage and greater eventual disability. And as was stated before, Rita's test results reveal 120 units per mil, and studies have revealed that rheumatoid factor is present in 80% of individuals affected by rheumatoid arthritis. However, not everyone with higher levels of rheumatoid factor has rheumatoid arthritis. People with other diseases may also have high levels of this rheumatoid factor. The current classification criteria for rheumatoid arthritis, so a definitive rheumatoid arthritis, is based on the confirmed presence of synovitis in at least one joint, absence of an alternative diagnosis better explaining the synovitis, and achievement of a total score of greater than 6 out of 10 on a scoring system. The score is derived from four criteria: the number and site of affected joints, serological abnormality, an elevated acute phase response, and symptoms, less than 6 weeks or greater than. So it has been suggested that ACPA testing also be included. And it was also noted that often levels of rheumatoid factor increase with age. A cohort study showed that individuals without rheumatoid arthritis, but with an elevated plasma level of rheumatoid factor, have up to 26-fold greater long-term risk of developing rheumatoid arthritis, and up to 32% 10-year absolute risk of rheumatoid arthritis. This evidence suggests that rheumatoid factor tests should be performed and methods adopted to reduce symptoms associated with. So how do her complaints of general fatigue and weight loss relate to the rheumatoid arthritis disease process? So Rita has causes of fatigue, so some symptoms of fatigue. The systematic review by Nicholas, Bode, Tal and Van der Laar in 2013 found that causes of fatigue were due to pain via the synovial swelling, disability, so limiting physical functioning, depression and depressive mood. Rita's complaints of weight loss. So going back to what I stated before, dry mouth, okay, loss of taste and dysphagia, which is difficulty swallowing, could lead to obviously less food intake, therefore loss in weight. Atrophy and body weight loss results from excessive pro-inflammatory cytokine upregulation. There are two types of cachexia, which is weight loss, have recently been described in rheumatoid arthritis patients, classic and rheumatoid. In the classic type, as seen in cancer, chronic heart failure, chronic kidney disease, or chronic infection, there is loss of both muscle and fat loss. So other organs that may be affected by rheumatoid arthritis. Rheumatoid arthritis can also produce diffuse inflammation in the lungs, the membrane around the heart, pericardium, the membrane of the lung, and the white of the eye, and also nodular lesions, which are most common in subcutaneous tissue. Eyes, lungs, skin, heart, and blood vessels, and other organs. Also, the medications that are taken with rheumatoid arthritis can have unwanted side effects, and dealing with a chronic disease like rheumatoid arthritis day in and day out may cause emotional distress. Many people with rheumatoid arthritis suffer from depression. A study by Douglas et al. Of 4,586 patients from 17 countries were analysed. Depression was among 15% of these patients. Asthma, 6.6%. Cardiovascular event, myocardial infarction, stroke, 6%. Solid malignancies, excluding basal cell carcinoma. 4.5% chronic obstructive pulmonary disease. Elevated blood pressure was in 11.2%. And identified conditions that manifest laboratory test abnormalities, such as hyperglycemia in 3.3% and hyperlipidemia in 8.3%. To manage the complications of rheumatoid arthritis, it is important to recognise problems early and get appropriate treatment. Thank you very much, and I'll leave you with these references that I've got here.